the ministry is planning 300 of these family medicine groups to be implemented throughout the province, and 300 will allow them to reach the entire population of Quebec. So everyone will be registered to one of these family medicine groups. The groups are made up of anywhere between 6 and 12 physicians, and they register between 12 and 24,000 patients. And finally, we have Ontario. To date, there's 1.9 million Ontarians who are enrolled in a family health team. I am one of them. And this represents 250,000 patients who previously, before these networks were introduced, did not have access to a family care physician. Based on the June 2009 budget, the government did announce that they're going to add another 50 family health teams in Ontario to the already 150 that are established, so taking that up to 200. And generally, the way the teams are structured is you have 10 primary care physicians and you have 7 non-physician providers serving on each team. And the numbers can range anywhere up to 100 physicians. These teams are very multidisciplinary, so you've got nurse practitioners, nurses, dietitians, mental health workers, and sometimes even pharmacists are involved as well, but the family physician is the lead on each team. And these family health teams provide services to general populations. However, sometimes in that target population, if there's very chronic conditions, they can be structured around that condition and tailor their services around it. This chart, again, is for your reference. I thought it was helpful. I know it was helpful for me, is basically to see all the various programs, the acronyms, how many physicians are out there, and how many patients. Because, again, it is very complex and confusing because there's no standard system. Each province, as I said, is operating on their own. And I would be remiss if we didn't mention for a minute Bill 179. So change in healthcare, as we know, is always a certainty, and Bill 179 plays a role in this ever-changing market. Currently, all of the key associations that are potentially part of this are in negotiations, but we know ultimately the goal is to authorize certain healthcare providers the ability to provide prescribed services with respect to the use of drugs. And so this chart really shows all the potential segments that there are and what they'll be able to do should this bill pass. So you've got pharmacists with the ability to administer by injection or inhalation certain substances, nurse practitioners dispensing, mixing, and selling certain drugs other than the ones that they already can. So it's something that we need to be aware of, and that leads to my final slide, which is around implications. So the question after all of this, complexity and the differences by structure is, well, what does this mean for us as sales and marketing experts in the pharmaceutical industry? And I just wanted to bring up 3 quick points. One around targeting and segmentation. So if you look at Bill 179 and you look at the dynamic of a family health team, there are so many new audiences that are opening up for us, and with respect to what they can and cannot do, we need to really, as an industry, look at that and decide, is this important to our business? Do we need to be aware of these new audiences? And the challenge, of course, with what Ron just talked about is we're doing this with less resources and limited resources. So when you look at, for example, if we're just looking at physician-level prescribing data, is that really too narrow now? Instead of looking at the individual, do we need to look at more of the total prescribing data of the entire family health team and what that opportunity does present? Again, multiple new audiences with less resources. So what's the best bang for our buck? The audiences also could very much differ by province. Regionality has been a theme today, and it's very present here in family health as well. So it's forcing us as industry to be more creative and innovative in how we get our message to this complex new audience. The second point, and this has been talked about, is regional planning. There was a question earlier about how many of us use one national brand plan. That's traditionally been the way that we were taught how to market, but I just don't think that's sufficient anymore. With so many different structures by province, it's really going to force us to look at more regionalized approaches and potentially regional brand plans by brand, by province. And again, regional resource allocation, regional segmenting, and regional marketing strategies, because even the definition of a segment, what we call a nurse in Ontario, may not really be what we call a nurse in another province with respect to the therapeutic areas we compete in. And finally, just food for thought on hiring and training. With this kind of complexity, we need to look at our hiring profiles in sales and sales management and marketing. Are we hiring people who have the ability to manage this type of complexity, and especially in sales management, if we're going to go down to actually provincial brand plans, obviously bringing those people in with an ability to strategically plan so that they can be successful in this new environment. So in closing, obviously a lot of change going on, hard to stay on top of all of it, but we as industry need to stay on top of this and be able to change along with it so that we can be successful. Thank you.